In the increasingly diverse American population, health disparities among minorities is a rising public health concern. Growing evidence indicates that minority populations lack access to healthcare services, experience poorer quality of care, and have subpar health outcomes compared to white Americans. These disparities are even more pronounced in the realm of mental health, with Black and Hispanic Americans seeking mental health treatment at only 1/2 the rate of their white counterparts, and Asian Americans seeking treatment at 1/3 of the rate. And among all those with mental illnesses, only 60% of people sought help within the last year. Contributing to high rates of homelessness, incarceration, and suicide, untreated mental illness can have devastating effects. Yet perhaps the most tragic part is that these outcomes can be prevented with proper mental health treatment. Though many factors influence the access to mental health treatment, even after adjusting for social class-related variables like poverty, lack of insurance, and less education, race and ethnicity still has an independent effect on access to mental health treatment. And when minorities do seek treatment, they are more likely to stop treatment prematurely. Other mitigating factors include stigma, language barriers, lack of detection and awareness, and mistrust of medical professionals. So eliminating disparities is not easily achieved. Recently, there's been a push towards reducing the stigma around mental illness and increasing mental health education. Researchers have also suggested integrating mental health with primary care, but this requires systematic changes that will take time to implement on a large scale, and the need is urgent. Thus, a new and innovative way to treat mental illness has emerged with the growth of biotechnology. A recent study published in the journal Nature highlighted a rise in the use of mobile mental health, or e-mental health, which refers to the use of internet and related technologies such as mobile phones to deliver mental health treatment. Mobile phones are prolific in today's society, and smartphones are becoming cheaper and more accessible even to low-income populations. Thus, mobile mental health apps may serve as a promising way to reach underserved populations, particularly in developed countries like America. By bringing care directly to people's fingertips, mental health apps reduce the stigma of seeking out treatment and eliminate any potential transportation challenges. Apps are also much more flexible and affordable than traditional therapies, which is especially important for minority populations who tend to earn less and work longer hours than their white counterparts. Today, there are hundreds of mental health apps on the market directed towards people struggling with anything from post-traumatic stress disorder to depression, addiction, and even schizophrenia. And while researchers are hopeful about the potential of mobile mental health, such technologies are relatively new. And though some research currently suggests that mobile mental health can improve patient outcomes, the data is limited and more research is needed. Fortunately, the number of clinical trials aimed at assessing the efficacy of mobile mental health is rapidly increasing, and more data will soon be available. These treatment methods reflect a larger trend in the changing landscape of the medical field. With the ever-increasing amount of medical technologies, it seems that we're now entering a new and uncharted frontier of medicine. We now have the tools to provide more personalized and accessible care, but only time will tell how these developments will affect the future of healthcare.